Hi, thank you so much. It's quite an honor to be part of this panel today, and it's really a pleasure to be able to share my story with everyone. Chronic pain has been synonymous with my existence since childhood for me. At 8 years old, I was diagnosed with migraine. So from childhood, I have had the burden of having to live with an invisible illness and going through the many stages of invalidation, dismissal, and unacceptance of having one. As a kid, I was exposed to how much migraine can take away from your life, and that experience was very painful. I was not the same as other children, and no matter how much I looked normal on the outside, my body prevented me from showing up in the world in the way that I wanted to. Now, as a woman who grew to have a wonderful marriage and 3 beautiful children, pain was still a major and persistent part of my life. By the time I was 30, I had chronic migraine, daily chronic headache, new daily persistent headache, fibromyalgia, and a 6, 7, and 10-year-old to take care of. Finding and receiving adequate and equitable care over the last 15 years has been more challenging than it should be. I have had to appeal many decisions not to cover treatments in order to ensure that I'm getting the most efficient pain management therapies. Access to see a headache specialist was impossible because my insurer refused every referral that I put in to see one because it was out of network. So that limited my care to neurologists who did their best, but they were not specialists in headache medicine. They tried what they could, but often I exhausted the most common treatments, which either failed me or they lost their efficacy after a few months. Thankfully, in 2016, a headache specialist was hired by my insurance provider. However, he is located in Baltimore, which is 2 hours from me. So every 3 months, I drive 4 hours round trip for my injections. Is it what I prefer? No, but this is my best option to receive migraine-specific treatments. As a woman of color, I have experienced too many times clinicians asking me if I am doing enough to manage my pain. There is often this implication that I am doing nothing to get better and just drug seeking. I am sure this could be an implicit bias stemming from the stereotype that Black people are lazy or substance abusers waiting for a handout. Maybe I'm on government assistance. Since I travel with a binder that validates the existence and seriousness of my disease, an urgent care doctor who I saw several times in the past thought it was okay to refer to me as the binder. When I self-advocate, I am perceived as angry or combative. A Black woman who is deeply knowledgeable about her disease and what treatments are effective for her is not always well received. A neurologist I was seeing for several years told me during an appointment that I was the reason why I was in so much pain, claiming that I was relying too heavily on medication and was not making enough lifestyle changes. After going down a laundry list of all the complementary, alternative, holistic, and naturopathic treatments I utilize outside of the necessary medical procedures and therapies that are part of my overall protocol, he was fired. I was no longer able to work due to all of these pain conditions. And that loss of identity was difficult because I wanted to also be able to provide for my family and not to have my husband carry that burden by himself. And him being a law enforcement officer, his job is extremely stressful. So to have a chronically ill wife on top of that wasn't what I imagined for us. So not being able to provide in the terms that I wanted to was a difficult thing to accept. So to help supplement my family's income, I applied for Social Security disability in 2005. It took 9 years to get a full award approved for Social Security disability. In 2018, Social Security determined that my health improved enough to go back to work, and they stopped my benefits, although I have daily chronic intractable migraine. It took over a year to fight and reverse that decision. Why did this occur? There are many reasons why. One, the Blue Book contains no listing for any headache disorders, nor are they updated on a scheduled timeline. The patient's voice is not a part of the disability evaluation process. The Social Security Administration discriminates against people with invisible illnesses by only using signs and not symptoms to determine eligibility. During my first eligibility hearing or determination hearing, the judge asked me, why did I have more children if I knew I had migraine? He approved me for a partial award, sending me on another long appeals process. The second judge to deal with that appeal spoke to me as if I wasn't even in the room or even a human being. And both of those instances were a great show of racial and gender bias. And it didn't stop there. After my approval, I had to undergo several disability reviews, sometimes twice in 1 year, to prove that I'm still disabled. And that causes a ton of anxiety for somebody living with severe disabling chronic illness who relies heavily on those disability payments to survive. Yet you have this administration that blatantly does not believe you and forces you to prove it over and over and over again. On top of that, I'm having to prove my pain in the clinical setting as well. It's exhausting. The Alliance for Headache Disorders Advocacy is working on a proposed solution to these specific issues. There is Patient-Centered Disability Evaluation Act. It looks to address these inequities through 3 main avenues, including the patient's voice in determination of the disability evaluation process, the Blue Book having all listings updated at least every 5 years, and addressing the discriminating policy, which was also part of the 2019 ask during our Headache on the Hill, of only allowing signs and not symptoms to be used to support determination of step 2 of the 5-step sequential evaluation process. This is extremely important legislation, which will greatly improve the ability for many people, not just with migraine, but with Emmy, CFS, to be able to be approved for disability. Because so many of us are unable to work because of the disabling conditions that our diseases have us in. Since COVID, there has been an impact on the continuity of care for me. I have been unable to access infusion treatments or acute emergency care for several flares of migraine. I had to postpone necessary in-office treatments to help manage my daily pain. But what has remained constant has been the availability of telehealth services. And this has been an option for me for many years prior to the pandemic. And it has allowed me to keep appointments despite having high pain days, and provided flexibility in scheduling, and allowed me to see my therapist and pain psychologist who are both in different states. So I don't have to do these long drives in order to keep my appointments. Migraine patients have been early adopters of telehealth. It is an important part of chronic disease management. And expanding virtual care beyond this pandemic is crucial for people living with chronic illnesses, especially women and people of color who are often burdened with childcare, are essential workers and may not have access to equitable care. In conclusion, the life of a woman with chronic illness is one that comes with many obstacles. Unfortunately, there is no roadmap on how you traverse the many roadblocks thrown up against us when navigating the healthcare system. You are forced to learn it through overcoming access barriers and self-advocating through your pain. Being a woman, my pain is dismissed as distress. Being a Black person, my pain is perceived as not being real. The challenge is who's going to show up in the exam room and see and validate my disease, as opposed to only seeing my gender and race. Thank you.